Basic neurological principles or Sherington's principles. The first one is after discharge. The effect of a stimulus continues even after the stimulus is stopped. If the strength and the duration of the stimulus increases, the after discharge also increases. Therefore, this results in a feeling of increased power that comes after maintained static contraction. For example, the same amount of pain remains after the pinprick is removed. Temporal summation. The succession of small stimuli over a period of time will cause more excitation than a big stimulus which is given at once. Third principle, spatial summation. Small or weak stimuli applied simultaneously to different areas of the body reinforce each other to cause excitation. Therefore, temporal and spatial summation can be combined for greater activity. The fourth principle is successive induction. An increased excitation of the agonist muscle follows the stimulation of the antagonist. For example, in elbow flexion, the biceps are the agonist and the triceps are the antagonist. The fifth principle is irradiation. Irradiation refers to spreading and increase in the strength of the response. It occurs when the number of stimuli or when the strength of the stimulus is increased. The response may be excitatory or inhibitory. For example, during hip flexion, giving resistance to hip flexors will irradiate to the foot, causing dorsiflexion of the foot. The last principle is reciprocal inhibition or innervation. Contraction of the agonist is accompanied by simultaneous inhibition of the antagonist. Reciprocal inhibition is required for coordinated motion. Relaxation techniques make use of this property. For example, during elbow flexion, the flexor muscles undergo concentric contraction, which means they contract, and the extensor muscles undergo eccentric contraction, which means they relax.